Hi everyone, I am Beulah Dallas, Assistant Professor Community Health Nursing Department, MMM College of Nursing. Today I am going to discuss about the adolescent health programs. The objectives of this session are, at the end of this teaching, the student will be able to understand the importance of adolescent health, explain about the ARCH program, describe about the WIPS program, educate about free sanitary napkin scheme to the community. Adolescence is a vital stage of growth and development. It's a period of transition from childhood to adulthood. According to World Health Organization, adolescents as young people aged between 10 to 19 years. That means from 6th standard to 12th standard studying children. Around 1 in 6 persons belongs to adolescent group. In the world, we have 1.2 billion of adolescent people are there. In India, we have 243 million of adolescents are there. What is the need to pay attention in adolescent health? Because to reduce the burden of disease in later life, we have to concentrate during the adolescent period. So what are the diseases we can expect in the later life? Mainly the malnutrition, it's a lifelong health problems, and the high incidence of sexual transmitted diseases because they have a risk-taking behavior, and the disease of late middle age in adolescents, that example the non-communicable disease due to their lifestyle changes. The major adolescent problems are risk-taking behavior, substance abuse, eating habits, example anorexia nervosa. They are having the fear about obesity, so they will eat everything and voluntarily they will omit everything. And lack of connectedness with the parents or other adult, etc. Early pregnancy, that is teenage pregnancy, and the sexual transmitted diseases. These are the major adolescent problems we can expect during this period. So the government of India and the state government of Taminado, they were initiating about some of the adolescent health programs to improve the adolescent health. So what are the programs? First one is ARCH program, second WIPS program, and the free napkin scheme. These are the main adolescent programs. It is developed for improving the health of the adolescent group. Let's see what is ARCH program. ARCH means Adolescent Reproductive and Sexual Health Program. What is the main purpose of this program? Is to reducing maternal and child morbidity and mortality. How we can reduce? By prevent teenage pregnancy, prevent anemia by promoting nutrition, and promote menstrual hygiene. These are the way we can able to achieve the goal of this ARCH program. What is the main aim of this ARCH program? This program plans to increase the health-seeking behavior in the adolescent age group and provide them with the right knowledge about various aspects of their growing life. Let's see the priority intervention of ARCH program. So adolescent nutrition, that is the main focus among this adolescent group. So here they are concentrating about iron and folic acid supplementation in order to prevent anemia among adolescent girls and boys. Facility-based adolescent program mainly concentrating about the reproductive and sexual health services. Mainly it will be conducted in the adolescent health clinics. This adolescent health clinic will be conducted in the PHC as well as in the Anganwadi center also. So information and counseling on adolescent sexual reproductive health and other health issues. Also, they will give counseling about the nutrition and menstrual hygiene, preventive health checkup. These are the priority interventions comes under this ARCH program. Let's see the approaches of ARCH program. So first approach is facility-based health services, and the second one is counseling through ICTC, and third thing is community-based interventions. So what is facility-based health services? Based on the need. If we want to refer to them to the PHC or the community health center or to the district hospital. Based on the need, we have to refer them. According to the level of the anemia, suppose they have the severe anemia, definitely we have to admit them in the district hospital or in the community health center and to give the iron supplementation through intravenous. And next thing is counseling, mainly in the ICTC, which is there in PHC and community health center. So this mainly for STD and the nutrition related thing. People will be referred to this ICTC through this ARCH program and giving the relevant counseling to that person. Next, community-based interventions. So here some of the adolescents not coming to the schools. So in that case, through the Anganwadi people, we can able to approach this people, those who are there in the community. The activities comes under ARCH programs are Adolescent Friendly Health Clinic, Facility-Based Counseling Services and Outreach Activities. Under the Adolescent Friendly Health Clinics, they are conducting regular routine health checkup for the adolescent girls and boys. Health-related needs, that is contraceptive provision, management of menstrual problems, reproductive tract infection or sexual transmitted diseases, management, antenatal care and anemia. Facility-based counseling services, they are giving counseling on nutrition, puberty, STA and RTA prevention, contraception, abortion services, sexual abuse, substance misuse, mental health problems. Outreach activities can be carried out in schools or in college or in the village itself. Mainly they will conducting a nutrition day in order to create awareness among the adolescents about the importance of nutrition during this period. The next program is called WIPS. WIPS means Weekly Iron and Folic Acid Supplementation Program. The main goal of this WIPS program is to break intergenerational cycle of anemia, because it's a major health problem among adolescent girls and boys is anemia. Next thing is to reduce incidence of anemia among adolescent girls and boys. So this weekly iron and folic acid, mainly they will giving to the school children, especially 6th standard to 12th standard students. They are belongs to the adolescent group in the fixed day on Monday or Thursday. So this will be implemented among the government school and the government aided schools. The main interventions carried out through this WIPS programs are supervised weekly iron and folic acid supplementation, that is 100 mg iron and 500 microgram of folic acid. As I told before, there will be a fixed day. Every Monday they will give this iron and folic acid tablets to the adolescent people through their noted teacher or through the ANM. Screening of the target groups, that is they will check about the hemoglobin. If it is a hemoglobin is very less, they will refer them to the specialized hospitals or in the PHC or community health center. And next intervention is biannual deworming. That means in the month of February and the August, they will do the deworming to prevent about the worm infestations. So worm infestation is the main cause for anemia. Next thing is information and counseling based on the need, especially for nutrition or related to sexual related health or related about the non-communicable diseases. The next program is Taminado Free Sanitary Napkin Scheme. Taminado government will provide free sanitary napkin to the government school girls in urban area and women inpatients at government medical institutions. The purpose of this scheme is promotion of menstrual hygiene among adolescent girls between the age 10 to 19 years in rural areas. So what are the interventions they are applying through this schemes are community-based health education and outreach program for the adolescent girls, ensuring regular availability of sanitary napkins, a free supply of sanitary napkin to the adolescent girls, especially those who are there in the rural area, a storage and distribution of sanitary napkin at the schools as well as in the community also. And in the adolescent girls, those were admitted for teenage pregnancy, in that case also they are providing free supply of the sanitary napkin. Next thing is training of Asha and Nodal teachers in the menstrual health, because these people will go to the schools or in the community, they will teach about how to maintain the menstrual hygiene and what are the importance of maintaining menstrual hygiene. About the safe disposal of sanitary napkins. So this is the machine, it will be there in the schools to do the safe disposal of sanitary napkin. It's a kind of incinerator. So far we have discussed about ASH program, WIPS program, menstrual hygiene program, its purpose, approaches and the intervention of each program. Let me conclude my topic. Adolescence is a period of curiosity when young people are receptive to information about themselves and their bodies, and when they begin to take an active part in decision making. Today's adolescents are tomorrow's parents, teachers, and community leaders. So we have to concentrate during the adolescent period to get a healthy parent, to get a healthy teacher, and the community leader in later period. Thank you.